Welcome back. India recorded over 168,000 new coronavirus infections. This has taken the total tally of COVID-19 cases to almost 36 million, which includes 4,461 cases of the Omicron variant, according to the Johns Hopkins Coronavirus Resource Center. The active cases rose to the highest in 208 days. The number of deaths also climbed. Meanwhile, Delhi today reported 21,259 new virus cases and 23 related deaths in the last 24 hours. Of the total, the cases of Omicron variant in the country, 1,711 people have recovered or migrated so far. Well, joining us to talk some more about the situation in India is Vishal Rao, who's a member of the COVID-19 task force there. Thank you for joining us on the program.
Namaste.
Namaste. We're seeing cases jumping in different states. Also, we know that India has begun administering the COVID-19 boosters for frontline workers and I believe the elderly as well. And then it will soon begin vaccination for teenagers. What other push is government trying or is government doing? And this is to stem the spread of the virus.
Thank you for inviting me for the program. I think we are at a very interesting juncture where we are seeing that in the race between the vaccine and the virus, the vaccination program seems to be winning. And that's a very significant step that we have been able to do to control the pandemic. So while we see that the numbers are rising today across the states, what has been reassuring is that the need for oxygenated beds and ICUs have been drastically low. Now, this seems to be a direct reflection in states that have had very good vaccination rates. The utilization of the oxygenated beds of the ICU has been very, very minimal, reiterating the fact that the current vaccines are working very well even against the new strains and reduce admissions for hospitalizations for oxygenation or ICUs. So at this juncture, the Indian Medical Council, ICMR, has come out with some very interesting latest guidelines, not encouraging asymptomatic people not to get tested. Now, I think this is a very important and a significant step that the government has taken to ensure that we reduce panic and avoid unnecessary blockage of beds. So coming days we will be watching this closely, and what we've learned from the data from South Africa has been that the Omicron rises very quickly and descends very quickly. So within the next 1 month, we are hoping that we'll be able to bring down these cases effectively, and at the same time, we are continuing to reemphasize to the general masses that vaccination seems to be the best weapon for controlling this pandemic.
So if someone were to ask with regards to the waves that we've seen so far, and, with Omicron as well, and we, of course, do not hope for another variant, but in terms of hospitalizations, in terms of, do you think that India is perhaps prepared for another strain of COVID-19?
Yeah, I think, like I reiterated earlier, what we know from the data from South Africa and from the Gauteng province has been that if you had 20% requirement of oxygenation or ICU related admissions in Delta wave, Omicron is only asking for 4%. Now, what the WHO Director General Dr. Tedros has reiterated has been that despite having such lower rate of oxygen requirement, Omicron still has the potential to overwhelm the healthcare system because of the rapidity with which it multiplies, which is about 1.5 days. So while we need not panic, and especially those who vaccinated have to be reassured to say that this is not going to get you to the hospitals. So we are slowly moving towards an endemic phase in this particular pandemic. But at the same time, considering the data that we've had in compared to what South Africa is, we know that the oxygen requirement is going to be less because of two primary reasons: very high vaccination rates in several states of the country, and second, there's a lot of compelling data coming out from the UK, from the US, from Hong Kong, and others, talking about how the Omicron strain does not damage the lung. Now, this is a very important thing for the viewers to understand, that the Omicron virus has a multiplication rates of about 70 times in the air pipe and in the bronchus, but not in the lung. In the lung, it's only about 10 times. So it drastically reduces its multiplication in the lungs. And if you are vaccinated, this gives you additional protection. So these are two key reasons why we believe that we need to work towards strengthening the immune system by amplifying the vaccination to the third dose. Israel today has moved to the fourth dose. So what I would urge through this, through your channel, to the people of this country and to the other people across the world, in Nigeria, across the world in Africa, is we need to get vaccinated. Today, Africa, many parts are still at below 5% vaccination. It's a very big concern. We have to make our best efforts to reduce the vaccine inequality. We have to increase the vaccination rate from 5 to at least 60%. And this has to be a combined strategic approach where the media channels help the government to improve and overcome the vaccine hesitancy. And I think that's the best weapon we have against the virus right now. And Africa should take this up seriously, and also look at 29 of the vaccine companies that are today ready and have emergency use authorization to open them and bring them to the country to increase the vaccination programs.
And talking about vaccines, is India mixing vaccines? For example, in Nigeria, you're asked to take a certain different type of vaccine as a booster. What's the situation in India?
So the current guidelines do not allow for mixing and matching of vaccines. It's called heterologous vaccination. That means you use the first one of a particular type and the second or the third one of another type. As of now, the government of India's guidelines, the ICMR guidelines, do not allow for mixing and matching. However, what data has come out from the USA's CDC, from the UK NHS, and many other global consortiums, including the EU, has been on two parameters. Number one, reactogenicity, and number two, immunogenicity. Now, both these parameters, it has been shown that when you mix and match and use a heterologous vaccination combination, it seems to be faring slightly better, which means there is one thing for sure, that at the end of 6 months, your immune system requires a reminder through a booster dose of the third vaccine to build its antibodies against the virus if it has another attack. So at this juncture, global guidelines say post 6 months, mix and match allowed, and that seems to have good amount of immunogenicity for the immune system and less reactogenicity. So with this data, I think eventually many countries will move towards a mix and match regime, and it's important that we all take cognizance of it.
We appreciate your time. Thank you so much, Vaishar Rao, member of the COVID-19 task force in India. Thank you for joining us today.
Thank you.